Hello, Dr. Andrew. Welcome to VNN.
Thank you for having me.
Doctor, unfortunately, COVID-19 cases in the community are on the rise again, and COVID-19 testing is available at William Osler Health System in the emergency departments and urgent care center for people who have symptoms. Can you elaborate more on this?
So we still want people to come to the emergency department if they have symptoms, if they have moderate to severe symptoms, if they're not able to manage their medical condition at home, if they have chest pain or shortness of breath, we want to see people in the emergency department. We are doing our best, even though our human resources are certainly stretched. We're doing our best to see people in a timely fashion and provide people the best care we can under these circumstances. What we are asking for consideration for now is that if you have mild symptoms, so a runny nose, a sore throat, a low-grade temperature for a day or two, muscle ache, those are symptoms that can be managed by your family doctor by phone. They can be managed at home. You should presume in the current context that you have COVID-19 and begin isolation. You do not need a confirmatory PCR test at an emergency department or an urgent care setting. We certainly, at the moment, at least the guidance is still to obtain a test, although with the prevalence as high as it is, if you have those symptoms, you are more likely to have COVID-19 than not. Mm-hmm. So we would recommend self-isolation. You should not come to an emergency department or urgent care in any location for testing for mild symptoms because we just don't have the capacity to manage that kind of testing volume.
For others who are asymptomatic or have mild symptoms, are advised to book their test online through community testing locations. Will holiday hours affect these appointments?
I think access to testing in the community right now is really, really tight. I think everybody is doing their best. But as we predicted with this wave, COVID-19 is affecting our health and human resources. And, when staff become ill or are unable to work, it is very difficult to staff those testing sites. So I think access to testing is challenging everywhere at the moment. Certainly in our region, it's challenging. We want people to book online, no question, but testing access, particularly for PCR, is limited. One way to recognize that is if one person in the family has a positive rapid antigen test and the other people have symptoms, they also have COVID-19. And you do not need to confirm a rapid antigen test at the moment that's positive with PCR testing. If you have a rapid antigen test that's positive, you have COVID-19, and you should follow the public health guidance around self-isolation. Mm-hmm. So I think that's where we would start. And if you have moderate or severe symptoms, you need to come and see us, and that's what we're here for. If you have mild symptoms, of short duration, you don't need to seek care in the emergency department if you're only seeking care for a test. Mm-hmm. If you, as a family, are unwell and you feel like you don't have access to a rapid antigen test and you feel like you need to be seen, send the most symptomatic individual in the family to see us, and we'll see you, and we will do our best. If that person can book one test online as opposed to 5 tests for a family, that will also help families manage that idea of knowing for sure that you have COVID-19, being confident in that, and then being able to manage symptomatic-based isolation beyond that. Mm-hmm. But certainly we can't test families of 6 people with mild symptoms in an emergency department or urgent care setting at the moment.
To provide an additional layer of protection against COVID-19, the province of Ontario has launched a holiday testing blitz to offer rapid antigen tests to individuals free of charge at pop-up sites across the province, as well as at select LCBO stores across Ontario. What is the situation like in the Peel region?
I honestly am not sure about that. I don't know the answer. I certainly think access to rapid antigen testing is challenging at the moment, and I'm not sure where we are at in our region in terms of access. I don't think the access is excellent, but certainly I wouldn't be able to comment further on that.
Dr. Andrew, the holiday season is on, and like previous years, people are advised not to travel because of rising COVID-19 cases. As a physician, how safe you think it is for the Canadians to travel?
We are seeing exponential rise in Omicron cases across the country. I think this is a very challenging time for everyone. And I have an enormous amount of empathy for people and how the effect on their lives has been. My own family's life, you know, the lives of all of our healthcare workers and the lives of Ontarians in general. I think that we have to do our best to limit our contact to only that is essential. I come from a place of privilege. I am, you know, I have a secure job. I have people who will cover me if I'm ill. I am privileged in every way. And so I recognize how challenging it is for others who don't have the privileges that I have. And so it's with empathy that I say, please limit your contacts to only those that are essential at the moment.
To add to that, at this time, there are bound to be some family gatherings and dinner parties. Do you think it's safe for people to do that? And what measures you suggest that people should take to protect themselves against COVID-19?
The risk of getting COVID at a family gathering outside of your immediate household right now is extremely high. And I think that that puts our system at significant risk. I think that you should follow public health advice, keep the gatherings very small, use serial rapid antigen testing if you're going to use it at all, be cautious, gather outside with masks on if you need to gather virtually. We are at a crisis point, especially from a human resources standpoint. The issue may not be a large number of COVID patients coming through the front door, although over the last number of days, we've seen a significant increase in that. The issue may just be that all of our staff are sick and unable to provide care for patients. And so that's why limiting contacts at the moment is really critical.
Finally, with Omicron variant rapidly spreading across the region, there's a lot of confusion and fear among communities. So what message you want to give to the residents of the Peel region?
Our public health messaging has been very strong on this. Vaccination, high quality, well-fitted masks, ventilated spaces, reduced gatherings. Did I mention high quality mask and vaccination? I think this is about limiting the spread as best we can so that we have the people who can provide us groceries and care for us when we have a heart attack and care for us when we have a stroke and care for us when we have overwhelming infection. We understand the anxiety is high, the anxiety within the health system is high. And the problem has never been beds or ventilators. It's always been staff. And exacerbating that with infection is dangerous. We have to limit that spread for that reason. So stay with us. The most important message is all pandemics end, but we are not at the end.
Okay, thank you, Dr. Andrew, for talking to us and taking out your valuable time.
Stay safe and stay well. Thank you for having me.
Thank you.